Okay, Supervisor Fletcher.
Great, thank you, James, and thank you to everyone who is on the line with us today. During these difficult times, we are even more aware and more grateful of our essential workers. Those are workers who are out there on the front lines every day, responding to a global pandemic, providing valuable healthcare services, public safety services. These are the folks that are doing the essential things, whether they be in grocery stores, pharmacists, healthcare workers, the folks who are making the core essence of what we need in our society to continue to function. And they are doing that at increased risk to themselves. During this difficult period where there's been stay-at-home orders, our essential workers continue to go to work. Many of them continue to engage directly with COVID positive or COVID suspected positive personnel, but they continue to leave their homes. And it is in that spirit of selflessness and commitment that they make that I think it is appropriate that as a county, we take a few modest steps utilizing available federal funds to recognize and appropriately compensate the sacrifice of these workers who are out there. So I want to talk about two different policies that impact two different groups of folks that we'll be considering tomorrow at our board meeting. The first is a hazard pay proposal, and this will just apply to County of San Diego employees who work for county government. And I will we'll walk through that proposal in a minute. And then the second are emergency childcare vouchers. And these vouchers will be a part of a program that makes childcare vouchers available to all essential workers, whether they work for the County of San Diego or for another entity. So two different programs. First, I'll talk about hazard pay. And then we'll hear from, we have two folks who are here with us. Since March, about 7,500 San Diego County employees have been considered essential workers. These are workers who are employees of the County of San Diego that they continue to come to work. Many of them continue to engage with individuals who have tested positive for COVID-19 or persons under investigation for COVID-19. These jobs include our public health nurses, our probation officers, deputy sheriffs, some in home health care, behavioral health, and a number of other essential workers. And so these workers are out on the front lines every day, and it seems appropriate. I was a Marine, and when we went into harm's way, we received combat pay. It was a recognition of the increased danger that we were going into and what we were facing. And with the availability of federal funds, it seems like an appropriate use of federal CARES Act funding to compensate these employees commensurate with the level of hazard that they face. And so we're proposed a 3-tier hazard pay that would be in place for until the public health crisis is over. Tier 1 would be a 5% salary increase for county employees who are working directly with COVID positive individuals and persons under investigation. These would primarily be those in healthcare settings, but these are for our workers who share the greatest risk because they directly engage again with COVID positive individuals or persons under investigation. Tier 2 would be a 3% salary increase for county employees who continue to engage with the public or with clients. These would be members of law enforcement. These would be social workers, protective service workers. These are county workers who continue to not only come to work, but also engage and interact directly with the general public. And then Tier 3 is a 2% salary increase for county workers who continue to report to work every day. These are workers who are exposed to their coworkers. And then the last thing is a up to $100 monthly reimbursement for workers who have to telework if they have documented expenses related to fulfilling their county functions. This could be things like Wi-Fi or printing, other types of things like that. So that's our hazard pay proposal. What we're voting on tomorrow is to direct the Chief Administrative Officer to take this framework, work with the collective bargaining units to assess what job classifications would be in what tier, prepare a proposal and bring it back to our board for adoption. And again, in our proposal, we would be utilizing CARES Act money. This is the $334 million of federal money that the County of San Diego has received to respond to coronavirus. So there would be no general fund impact associated with this. The second proposal that we're going to be considering is $5 million for emergency child care vouchers. Healthcare workers, first responders, employees of essential businesses are working daily to protect us, and they're having to pay for child care because children are not in school. When we close the school, that obviously serves as the child care facility for most everyone. Second to that, you may rely on a family member, a grandmother, an aunt, somebody like that to provide childcare. But if those individuals are in high risk populations because of their age, then those are no longer available. And so the policy that we're docketing for our board to consider tomorrow is one that would have the County of San Diego allocate $5 million of County of San Diego CARES Act federal money to support the emergency child care vouchers for essential workers and vulnerable populations. To carry out this proposal, we'll partner with the YMCA and Child Development Associates to administer the funds. These entities have experience locally distributing child care vouchers through an existing state program for low-income workers. But the need continues to be great as funding is drying up as quickly as it is made available. Many are being put on a waiting list for child care vouchers. We're grateful and appreciative of the efforts of the state of California and some philanthropy and nonprofits, but the reality is the need is much greater than what is presently available, and this $5 million contribution will help, and it will help a number of workers throughout San Diego County. We'll leverage existing state programs, having the YMCA and CDA use the similar administrative family eligibility criteria and program guidelines detailed in the California Department of Education Early Childhood Learning and Education Division Management Bulletin, expanded their programs to essential workers. So these vouchers will remain available until the funds are fully exhausted or by December 30th, 2020, whichever comes first. I believe this is an appropriate step for us to take as a county to support our frontline workers, to alleviate a little bit of their burden, and to help ensure childcare for them. First up to speak to this, I'd like to introduce Kim McDougall. Kim is the Executive Director of the YMCA Child Resource Services. Her organization would be one of the two organizations we would work with to administer the $5 million if our board supports the action. Kim is going to talk about the work they have been doing to distribute state and local care resources and talk about the demand that she is seeing from families for child care. And so with that, I will kick it to Kim.
Great. Thank you so much, Supervisor Fletcher. It's really a pleasure to be here. My name is Kim McDougall, and as mentioned, I'm the Executive Director for the YMCA Child Care Resource Service. We are a social service department of the YMCA of San Diego County, and for over 40 years, we've been dedicated to providing free and low-cost services to the community with a focus on matching families with child care providers that meet their needs, helping families access financial assistance to pay for childcare services, as well as working with childcare providers to help them run their businesses. We are really incredibly fortunate in San Diego County to have a very strong and diverse childcare infrastructure. The COVID-19 crisis has underscored how critical this is to keeping our families and ultimately our economy thriving. During this crisis, childcare providers are essential workers in their own right, and they are caring for children of other essential sector workers. Currently, childcare availability remains very strong, with over 3,700 providers open and eager to support the community, and this accounts for over 98% of family childcare homes, as well as 50% of childcare centers. Our childcare providers are doing all that they can to keep their doors open and, at the same time, protect their small businesses to make it through this crisis. Unfortunately, many of these small businesses are caring for fewer children, as well as generating less income as families follow stay-at-home orders. Without targeted investments and support, many providers fear that their businesses will not survive. If these businesses do not survive, San Diego families will face a severe childcare shortage as we go through the phases of reopening our economy. Demand for childcare during COVID-19 has also been, very high. We, as the trusted source for childcare referrals in the County of San Diego, as of March 14th, have received over 800 requests from essential sector workers for childcare referrals. And across the board, families come to us and ask for childcare only to express they cannot afford it without financial assistance. With childcare supply available, demand high, it really comes down to the price of childcare as being the major barrier families face when trying to get the childcare they desperately need. This is exacerbated now, as Supervisor Fletcher alluded to, with schools and after-school programs closed and many employees needing to work extended hours. This means families are now forced to find and pay for childcare during hours they may not have previously needed it. The unaffordable price of childcare is a reality for many of us, even in the best of times. Local families can pay as much as $16,000 a year in childcare expenses annually, more than families are paying to send their children to college. Because childcare is critical to our economy and moving families out of poverty, the federal government, as well as the state government, funds a long-standing program that provides financial assistance to cover this high cost of childcare for low-income families. Run locally by ourselves, the YMCA Child Care Resource Service, as well as Child Development Associates for over 40 years. This program pays child care providers on behalf of families so they can go to work, they can go to school, and they can pursue employment. It really is an essential service to support families that need help moving out of poverty. Funding, though, for this program is very limited. It can only serve 1 in 9 eligible children in our county. In April, we're very fortunate that Governor Newsom allocated $5.1 million for this program to support emergency childcare access for our eligible families. This launched on April 23rd in anticipation of serving approximately 2,600 children of essential workers. And within less than a week, funds were exhausted and we have had to put families on wait lists. There is a true demonstrated and pressing need for financial support to cover the price of childcare so our essential workers can keep us healthy and safe. There's also a professional and passionate childcare workforce that's ready and willing to serve our families, and there's an existing and respected infrastructure ready to deploy funding and administer financial support for childcare. With a $5 million commitment in federal CARES funding from the County of San Diego, we can connect essential sector workers to emergency childcare and bolster our local childcare infrastructure so that our infrastructure is strong and ready to support our community and strengthen our region's position for economic recovery after this crisis ends.
Thank you. Thank you so much, Kim. We appreciate that. Next, I'd like to welcome Elsa Gonzalez. Her job is being a mother to her 9-year-old daughter. Her other job is as a healthcare interpreter at Tri-City Medical Center. She's going to share her story with us and really explain why making this $5 million available would help so many of our working families out there. So Elsa, thank you for joining us.
Hi.
You're good. Take it. Elsa, you got to click the little mute button there. You want to unmute yourself? There you go. There you go. Now you're good. All right,
Okay,
take it away.
thank you. So my name is Elsa Gonzalez. I'm a healthcare interpreter at Tri-City Medical Center. I work 3 12-hour days. In the beginning of this global pandemic, I was working 6 12-hour days, which is not normal for us. Normally, we work 4 to 5 days at the most, not 6. Normally, my primary duties are interpreting for limited English-speaking patients. Most of my hours were spent in the ER and labor and delivery and postpartum. Now, most of my days are spent in ICU. With COVID-19, it's been very difficult because hospitals are not allowing families to come and visit their loved ones. So we have been trying to communicate with the families via conference calls or FaceTime. Unfortunately, most of the times when we are FaceTiming the families is when the patients are not doing well. And we just want them to see their loved ones, even if it's going to be for the last time. I have a 9-year-old daughter. Normally, she goes to school and the after-school program. Right now, it's been very much more difficult because there's no school, no after-school program. I have a daughter-in-law that's helping me with her. Normally, my uncle and aunt, my uncle's 86, he was kind of my backup person. But with COVID, I don't want to expose them. I haven't called them or asked them for help at this time. I have applied for funds from the County Care Act funds For families like me, I'm hoping that if the Board of Supervisors passes the proposal, it would help families like myself. I am on the wait list, so hopefully we will get off the wait list and receive childcare that they need or that we need.
Wonderful.
Thank you.
Thank you so much, Elsa. Thank you. I want to thank both Elsa and Kim for joining us. I also want to thank everyone out there who has been a key supporter of this effort, whether it be our healthcare workers with their unions, firefighters, San Diego Police Officers Association, SDIU Local 221, and so many others who are supportive of providing this help and assistance to our frontline workers, to our essential workers. This child care proposal in particular feels like a very modest step and a very small thing that we can do to help make the lives of our workers a little bit easier. And then our hazard pay, again, is a very modest step, I believe, that we should be taking to recognize the sacrifice made by our frontline county employees in the county of San Diego. It would be my hope that my colleagues on the Board of Supervisors would support us in these efforts tomorrow. With that, I think we're going to open it up to questions.
Okay, so we're going to call on Jill first. Jill had a question. Here, Jill, here you go.
Great. Hi, thanks Elsa, Kim, James, and Supervisor Fletcher for hosting this today. I had two questions. The first one I wanted to ask has to do with who exactly will be included in which tiers. It sounds like that's partly going to be a conversation through collective bargaining, but just to clarify, in your mind, do you see people who are like regularly coming in contact with people who might be COVID-19 positive but don't directly care for them? Where do they fall? So like pharmacy technicians, staff at the psychiatric hospital, people like that.
Well, that's why we're directing the CAO to go work with the bargaining units to really assess what job classifications belong in each tier. The intent of the tiers is to try to properly compensate and reward based on the risk. An individual who still comes to work but only is exposed to their coworkers faces the lowest risk. An individual who interacts with the public but not directly with suspected COVID or PUIs, kind of the second tier, and then the highest tier are those who routinely engage or interact with either COVID positive or persons under investigation. The easiest way to do it, though, is to have our CAO meet with the bargaining units and work out which job classifications belong in which tier. Then we can have an actual financial analysis of what it would cost and then bring that proposal back to the Board of Supervisors for adoption.
Okay, got it. Thanks for that. Yep. And the other point I just wanted to make, obviously this is something SEIU Local 221 has been asking for, hazard pay. They've also been asking for better like leave policies and policies for people who are sick or afraid of going to work, and then to try to reduce the hazards by having more access to like masks and things like that, protective equipment. Are you looking into those other concerns that they have as well?
We've been working on a number of those. I think the sick leave policy is one they're working on through negotiations, and I would hope that they would arrive at a solution to that soon. It sounds like that piece is close to being able to be addressed. And the personal protective equipment is an ongoing challenge that everyone faces as a region. It is a very difficult thing when the entire world is trying to acquire the same limited supply of personal protective equipment. So we are working as best we can to get all of our workers what the best we can in order to protect them. And I know that they understand and appreciate that. And so that's an ongoing effort, and both of those efforts will certainly continue.
Great, thanks so much.
Okay, I think our next question will come from Sal from Fox 5.
Different subject matter. As you know, on the 19th or so, your counterpart, Kristen Gaspar, sent a note to the White House seeking help for Mexico to prevent or help them with the coronavirus, in a sense, to keep it south of the border. The president has taken it a step further. Now he's saying that we as Californians don't want people crossing or coming over the southern border. I just wanted to get your thoughts on what the president has said, and perhaps on Ms. Gaspar's letter to the White House a couple weeks ago.
Well, I think when you look at the reality that the U.S., Canada, and Mexico have a joint agreement in place to protect all three countries from the challenges faced with coronavirus, the actions that are being sought and taken are ones that are designed to protect public health in all three countries. And so I think it's ridiculous that the president would try and score political points off of a public health crisis. This is a time where we need everyone to come together, and we can come together by providing support to our friends and family members south of the border. We can work together to achieve this aim, and it would be my hope and desire that we would continue to do that and not seek to try and exploit a crisis to drive home some political point. And so I was disappointed in the president's tweet, and again, I think this is a time in our country where there will be plenty of time for that in the future. Right now, we need to focus on the immediacy of the challenge we have in front of us.
Supervisor, would you forgive me? Would you mind repeating what you just said, especially the last part? I was getting some interference.
That's okay. Now is the time as the country, we need to come together. We need to take action working collaboratively to address the challenges of coronavirus. It's disappointing to see the president take good faith effort and actions on the part of helping one another and try to exploit them to score a political point. I don't think that's what our country needs right now. My focus has been on working in a bipartisan way, working collaboratively, working together to try and address the challenges we face, both here in San Diego and in Mexico. And I would like to see us all move forward in that same spirit.
Our next question comes from Matt from KPBS.
I just why bring this proposal now? I know we've been going through this for about a month now. And then can you tell us just like what type of employees? I know you talk about people who come in contact with people every day. Like we talk about like deputies, park rangers. Do you have just some examples of who could be getting this hazard pay?
Well, Matt, the three tiers kind of outline, individuals who directly encounter COVID positive folks or persons under investigation. So these could be public health nurses that are doing the testing, that are doing the screening, could be individuals providing treatment in our public health motel rooms. But that is one tier. The second tier is individuals who come to work, but they interact with the public. Those would be things like sheriff's deputies, social service workers, protective child workers, things like that. And then the third tier would be county workers who still come to work and are around their co-workers, but not necessarily in a job that faces the public. The actual work of assigning every job classification in the county into the most appropriate tier is what we're directing in our board letter the chief administrative officer to do, working with those bargaining units to assess who fits in what tier, along with the financial impact, and bring it back to us. The reason I believe that we're moving now on this is partially the desire to help our frontline workers, but it's also the availability of federal CARES Act funding. That funding has been provided to the County of San Diego to spend appropriately in response to the COVID-19 pandemic. And I think that these are appropriate expenditures of these funds in both ways. One, in the child care, which will help all essential workers, whether they're employees of the County of San Diego or not. And then the hazard pay, which will just provide some additional pay for our County of San Diego employees. And I think given the availability of the federal funds, it is my belief this is an appropriate utilization of those funds.
And then can I have a quick follow-up?
Sure.
When talking about the money for this, so it's all coming from federal funds, and then is there any idea, like if this does get passed, of like how much money there is and like how long the hazard pay could be in place for?
Well, we outlined that we would plan the hazard pay would be through the end of the year or the end of the public health crisis. We have a public health state of emergency that's been declared by our public health officer. And so it would either go to the end of the year, or if the public health crisis ended before that, it would stop at that point. If we got to the end of the year and we were still in a public health state of emergency, then we would have to reevaluate and reconsider moving forward, probably in part based on the availability of CARES Act funding that remains or the conditions on the ground.
Kim, did you want to follow up on that? I didn't know if you put your video on, so I wanted to check if you wanted to follow up or not.
No, I agree. It's due to the CARES Act funding becoming available has made this something that I think is now a reality. It was a need since day one, and now there's actually some funding there to support it. So we've been waiting for the state government to do, you know, a little bit in this arena as well, using their CARES funding, and that is yet to happen. And so this is a way we can fill the gap with county CARES funding. So same answer.
Thank you.
Mhm.
Are there any other questions? Don't see any. If not, Supervisor, I think we're done.
Great. I want to thank, in particular, Kim and Elsa for joining us. And in particular, I want to thank all of those entities and groups out there that are supportive of this effort. You know, your support of this effort is appreciated, but what we are trying to do is appreciate you by providing funding in childcare to let you know that we do know how difficult this time is. We do know the difficult burden you face as essential workers, the challenges of childcare in an area where schools are closed. And so we are incredibly grateful and appreciative to all of our frontline and essential workers who are out there every single day, making sure that our core functioning continues. And so whether that be a police officer on the front lines, a public health nurse, or like Elsa, a medical interpreter, we want to do everything we can to help you. And all of our county workers who are out there, again, in our separate proposal, we would like to recognize and reward the hazard and danger that you're being exposed to by continuing to make sure our county government functions. And I think this is an appropriate step. And I would certainly hope that my colleagues would support us moving forward tomorrow so that we can do the right thing by our essential workers. So thank you all for joining us. We appreciate it. And we will be sure you tune in tomorrow, see how it goes. Thanks.